Wagner. It's Nurse Deshawn. How are you today?
Good, how are you?
I'm good. I'm here to change your dressing on your central line. I just washed my hands out in the restroom, so my hands are clean. I'm going to go ahead and put some of these gloves on so that I can take the dirty stuff off. Now, then the central line goes straight into your heart. I will ask you if you could go ahead and place a mask on and not try and turn this way as I clean it, so that you're not breathing any kind of bacteria on it. It goes into the supravena cava, and so the first thing I'm going to do is I am going to start peeling this off, okay? So whenever I peel the central line, I like to start at the top. I like to hold the central line so that it does not pull out. You can see right here we have it sutured in. Alright, and there it is. So we have the central line there. We have three port. You can see that the proximal is used for blood draws. We've got blood in that. You can see that the medial has CPN. And you can see that the distal, we just have it open flow to keep saline in it to keep that open flow. Okay, so now I'm going to go ahead and start to open my central line dressing. Move it over here. I'm going to go ahead and take my dirty gloves off. I'm going to grab my mask so that we don't breathe on her area and keep it clean also. And also I'm going to pinch out my gloves and stick them right here. I'm going to go ahead and open this, which is my sterile field. With the plastic side down, we have 1 inch on each side of this that is unsterile. So I'm only touching the 1 inch edges. Okay. Go ahead and get my sterile gloves on. On the right. So we will take and put the gloves on. We can go with this one. All right, okay. Since this is sterile, I can touch this. Okay. And then, as Ron would say, I'll have somebody else pick that up later. Now then, all of this is sterile. We've got all of this in here sterile. So I'm going to go place it on my sterile field, each item. Now, Miss Amy, are you allergic to shellfish or iodine?
No.
Okay. The reason why I ask her that is because we do have iodine in here, and I hear we're going to HIPAA. For this time, I'm going to use the alcohol swabs on her so I don't turn her skin any different color. So, and what I'll do, since I am completely sterile, is we'll start on the inside of the skin, right next to the wire. And we'll clean outward. And we'll drop this into the trash. Go a little bit further on the outwards edge with the third one, and drop that one into the trash. And the last one, we want to clean the line underneath and all around the line, right up in here. Now that that's clean. Okay, so now it is time to put the new bandage back on. So once that's clean, oh, the skin prep, there's not skin prep in here. On the skin prep, I would do it on the outside edges of the skin so that it helps stick it down, but we don't want to put it on the actual area. The only thing that we touch with the actual insertion site is either the iodine, the HIPAA-CLEANSE, or the alcohol pads. Now I'm going to place this with the little bitty cut edge right on top of where the edge of the line would be, right here. And so now that completely covers the line. And then this you'll pull off. Now that it's covered, you're okay to not be as sterile, but you want to make sure that is completely around that and all the way around. On this, I will put my name, date, and it says gauge. It is 10/1/2020, so that they know when they need to change it the next time. And we'll just place that right up here onto the patient. Did that hurt or was that okay?
That was great.
Great, good deal. There's also measuring in here if there's any kind of wound that's going in. 4x4 if you need to clean up anything more, but it's all sterile. So that's the end of doing the dressing change. And Miss Amy, I got orders right here of doing a blood draw on you. So on your bracelet here, what is your date of birth?
7/12/1992.
Okay, and I can see Amy on this, and Amy is on the order. All right, so with that, you don't need sterile gloves, but you do need regular gloves. Working with a blood product. So we've got our gloves, and these are non-sterile again. And the first thing I'm going to do is, which one am I going to use, is the proximal, which is the white one. If we had a normal one, this here would be white, this one here would be kind of brown red, and then this one here would be blue. So on the end of mine, I don't have a alcohol clip, so what I'm going to do is I'm going to clean this edge because it goes straight into the heart for 1 minute. Okay, now that that's been 1 whole minute, I am going to flush it. And since I have this sterile now for the 1 minute, I don't ever want to let it down. Whenever you get your flush, you want to make sure you pop that so that you don't get any air bubbles. You don't want any air bubbles in there because it is so close to the heart. And if this was a regular flush, I would flush it. So here I am flushing it. Okay. All right. Once I've flushed it, and forgot to tell you, there's also clamps on these. Mine does not have clamps, but if there was a clamp, I would unclamp it and then clamp it back. And each one of the end of these have a safety mechanism so that blood or air does not go into it also. So it's just doubly secure that no air gets into the heart. So now I clamp it back, and I'm going to go ahead and start with the first draw. This tip is sterile. So the first draw I do is gonna have 10 cc's of waste, and then I'm gonna do the blood draw. I'm gonna go ahead and pull that 10 cc's and pull it. Okay, then I'm going to clamp it. I also have my tubes here so that if it needs to get in there so it doesn't coagulate, or it needs to coagulate, we're gonna put those in there. I'm going to flush it again with the 10 cc's. And then depending on the policy, this could be heparin, and I would flush this with 10 cc's of heparin. Each time I would clamp and unclamp in between each one of these. Once I'm done with that, so that it is sterile, we're gonna say this is one of those green caps that is sterile. So we lock this down. How I made my 3 lumen, this is actually feeding bags, and I used feeding bags. We used a little bit of Duoderm as her skin here, and we taped it to it to make it look like it is a central line. And just food coloring, Pediasure, and water. And that's how I made my 3 lumens. And we have Amy, thankfully, to help us with this. Miss Amy, is there anything else that you need today?
No, I'm good. Thank you.
All right. Well, thanks for looking at my presentation, and I hope everything is understood. And have a good day. Bye.